Alright, now this is an image of a healthy thyroid. In the ultrasound, we are looking at it from the outside, which is up there, and we are able to penetrate our gaze to the inside. So what you've got outside here is skin tissue, then you have subcutaneous tissue, then you've got the connective tissue that is covering the muscles. Here are muscles before here. And the thyroid is actually this here. This is the right lobe. I'm trying to do a circumference here, and here is the left lobe. And what is important to see is that the healthy thyroid has a whitish gland structure. It has a sharp definition against the surrounding tissues. You've got clear borders. When you've got an inflammation of the thyroid, what disappears in the beginning is usually that clear border, and then it starts to affect the muscle tissues. Here are healthy muscles in the ultrasound image, which is something that immediately changes when an inflammation affects also the muscle tissue. It becomes whitish and loses its structure. And when you look at the patient who's had a Hashimoto's thyroiditis for 5 or maybe 10 years, you can already tell that they've got that, because you look at their neck in front and you see that the tissues are contracted. So most of the time, before I'm even looking at it in the ultrasound, I can already tell what is happening. Unfortunately, in the English hemisphere, in the English-speaking hemisphere, doctors don't do ultrasound, which is a clear disadvantage when checking the progress they are making when treating the thyroid. When it comes to the size of the thyroid, usually by just looking at this picture and comparing it to the cross-section of the arteries, the large artery, the carotid artery on the neck, I would be able to say if this is a healthy, normal-sized thyroid, or if it has enlarged or become smaller. There's a big problem when measuring the thyroid and having the computer making most of the decisions, or especially the calculation, because what you do here is you pick 3 distances, like distance from here to here, which is usually about 1.3 centimeters, about the same distance from here to here, and then you turn the image and you look at it from the diagonal section and take a distance there also, and then have the computer essentially tell you what the volume is. So the volume looks like something that you have measured, and you have a clear understanding what the size of the thyroid is, but you have to also understand that it's very difficult for a computer to calculate the volume of a structure that has a very different shape sometimes, and is not an ovoid or round structure. So what I prefer to do is actually take these 2 distances. I have a cross-section of the right lobe of the thyroid and of also the left thyroid, and then I try to create the same image when I do a follow-up, and then I compare the images. That tells me much more precisely if the thyroid is shrinking or if it is growing. And another factor that is usually not considered is, if you have an acute inflammation of the thyroid, it is swollen. And if your therapy is effective, then it is no longer swollen. So it shrinks by just returning to normal size, to the size that it actually has. It's not inflated by inflammation. And what happens is usually that the technician is doing the ultrasound check, and then the doctors are comparing the volume, and then they're saying, oh, you've got Hashimoto's and your thyroid is disappearing, when actually we have a lessening of the inflammation process. And what appears to be a detrimental outcome is actually one step in the right direction to the curing of the thyroid. So in the initial steps, it actually does shrink because it is no longer inflamed. Other structures that you can see here, this is the cartilage of the trachea, and in this section you can no longer see any structures because ultrasound cannot penetrate air, so you have this big dark image behind here.